I mix what I like, what I like, what I like, what I like, what I like. Welcome everybody back to I Mix What I Like, right here at I Mix What I Like. Again, I'm Jared Ball, happy to be your host, and I'm very excited to have with us two very special guests. I've already talked a little bit about their work. I'm more than excited to have them join me now. Kendall Riley, I should say future doctors, Kendall Riley and Erika Brown. Welcome to the show. Thank you very much. And thank you for your already incredible impact and work. But welcome, welcome.
Thank you. We appreciate it.
Happy to be here.
So I know folks may be a little bit more familiar with future Dr. Brown and Brokish. I hope everybody is subscribed and paying attention and following their great work, and they'll be with me and Renee on Saturdays with Renee this week, again on Black Liberation Media. But Kendall, if you don't mind, if you would just say a word or two about who you are and your work to folks who may not be aware yet, and how you've come to this particular topic, would be of great interest to me as well. But again, welcome and thanks again.
Oh, thank you for having me. I'm happy to be here and excited to talk about financial literacy, healthcare disengagement, and everything else with you both here today. I am a PhD candidate at the University of Iowa in sociology. I do a lot of work around the criminal legal system contact and how the states really exert their power across these other institutions like child welfare, healthcare, and immigration, and how that in turn might shape people's health within that state. So I'm really excited to think more critically about how financial literacy and how these institutions have kind of exerted power in this other way and kind of offshoot some of that responsibility to people with you all here today.
Right on, excellent. So before we get to anything, could you both give us an overview and a summary of what you intended to do with this, beyond the spin that I was putting on it and having fun, but in terms of this brand new article, which we will be talking about, or starting at least from, when financial knowledge isn't power, how race disrupts financial literacy's relationship to health precarity. The link to this article will be in the show description, so if you have not read it already, please do. But uh, again, if you could talk a little bit about how you both maybe came to work together on this piece, and what brought this particular overlap between financial literacy and healthcare. And then I know one of my selfish questions has to deal with the methodology, because that's just way over my head. So let's start there. How did you all come to work together, and then this overlap of financial literacy and healthcare? And Erika, do you want to start? Yeah.
Yeah. So in terms of the paper and sort of why this paper, what does financial literacy have to do with health? Because off the top, it's not, these aren't topics that people would naturally put together. And I want to say that it's because there was some, light bulb that went off. But honestly, I'm like a lot of students, and I was working with a data set. And when you're working with a data set, you're looking to see what the data set has in it. And as a part of my work as sort of an emerging sociologist, my key area of focus is financial literacy. So I'm interested in racial capitalism, and I'm interested in financial literacy. And so as I was working with the data set, was thinking about what are the things that I think financial literacy can have an impact on. And so the data had access to this information, and it was kind of like, that's interesting, right? Because I hadn't seen this intersection of financial literacy and health. Of course, people are always looking at financial literacy and what it does to your financial life, meaning all the things people think about when they think about money. So we just thought it's an interesting thing to put these things together. And so in starting to kind of get, work through all of this, and, the process of having people give you feedback on your work, because Kendall and I are in sort of an online work group, I'll call it, together. She was kind enough to help me sort of flesh all of this out. But in my work in general, I'm looking at a very high level. I'm looking at financial literacy and its impact overall, because what people tell us is, they say, if you get financially literate, all of these other things will happen for you, right? So you'll have money, you'll be able to accumulate wealth. If you're watching the podcast and on social media, this is how you find your financial freedom. We get all these promises about financial literacy. And so this data set and this data helped allowed us to be able to look and see in this specific area of health precarity, and we can talk about what health precarity or health disengagement means. What does financial literacy do for you, if anything? So that was sort of how it all. So for me, a lot of roads point to an online space. And so Kendall and I working together in this online space came together and collaborated. And here we are today.
Very good. Very good. Kendall, did you want to add anything to that, how you came to this particular that you haven't said or hasn't been said already?
Well,
Or anything else?
I think Erika just about covered it. I think coming to this work as like a primarily health scholar too, it was really interesting and thinking about, and apparently my cat is going to join, and thinking about how, financial literacy has been sold as this type of resource that people can tap into and can sort of attain and receive education to become more financially literate, and then thinking about what that might mean for their health. And I think, as Erika and I write about it in the paper, like therefore people are forced to become these like money savage, not savage, money managers, and
Savvy, right.
yeah,
Yeah.
that's the word. And just thinking about what financial literacy is supposedly doing in that, health process for people, and knowing how to, engage in these other spaces in ways that can protect their financial interests and also just help them, help them maintain their financial well-being while also improving their health. So that's kind of really how I came to this project, in addition to, being really interested in how we're measuring these things and thinking about testing them and whatnot.
So the two overriding subject areas, the health precarity and the financial literacy piece. Maybe we can start with what you all mean by both of those, because from the layperson's vantage point, everybody's doing well and has plenty of health care. So what could possibly be meant by a need for financial literacy and or a concern for health precarity? But but yeah. So what does all of that mean? Where are we starting, at least when we pick up where your work takes us?
Yeah, so health precarity can mean a lot of different things, but in the context of our writing, we're looking at health precarity through this scale that we've created, right? And so to create this scale, there are basically three inputs that we're using. And because we're talking about money, we're looking at people who were not able to get a prescription filled because they didn't have enough money, people who couldn't have a medical test or procedure done because they didn't have enough money, or people who couldn't see a doctor because they didn't have enough money. And so we're combining those three elements together. And that's what we call the health precarity scale. So that's essentially people having to opt out or disengage from taking care of their health because they have a lack of resources. So we thought these things all put together were an apt way to be able to see what kind of an impact like financial literacy would have on people's ability to do these things or not do these things related to the money that they have. So that's essentially what health precarity means as a scale. It would be, I don't know which page you have, Jared, but it would be on page 5 of the one that I have in terms of the measures that we're using.
So
So
is this
that's
is what's on screen correct? Because I'm seeing this is this is actually my page 6, but it's the health precarity scale. At least this table here is talking about that.
that's the scale overall. So if you go
Okay.
just right before that, yep, on the bottom, that just shows you the inputs that are in the scale, right? So we're talking about people didn't have money for a prescription, people didn't have money to get a test, people don't
Mhm.
have money to go see the doctor. So those are the three things, and we've combined those three things to make this composite.
Okay.
And then from there, we are basically looking at then all of the other things that might have impacted people's ability to do these things, right? So if you're thinking about not going to the doctor because you don't have money or not doing these things, it's not just financial literacy, right? We're never just talking about a single variable. Social sciences are all about all of these variables weighing in. So then we're looking at some other variables as well, right? So we're looking at how old the people are, the race of the people. We're looking at the gender of the people. So all of these are other things that are coming into play for what we talk about when we talk about health precarity. But Kendall, I don't know if there's anything else you want to say about the scale or its construction or.
No, I think you just about covered it all. I think that it's really important to consider like how overlapping all of these items were that made the individual scale up. If you scroll back up to the top here, to that correlation table right there, yeah. I think it's really telling how many people were experiencing multiple types of these dimensions of health precarity is kind of how we're thinking about it. So, people that weren't able to afford to go get a test were also very similar to the people that weren't able to go see a doctor due to cost related concerns. And I think this scale really does a good job at capturing that overlap that people were experiencing, that compounding effects here. So whenever we're talking about this and whenever we are measuring these other things that might impact someone's ability to feel like they can afford to go seek healthcare and go seek out information about these concerns that they're having, we're really talking about that shared overlap between all of these different items. And I think too, something that's really powerful about this project is we're also considering their access to health insurance too, which is such a huge barrier to even seeking medical care in and of itself. So I think the fact that financial literacy still came out to be such a strong and potentially strong, but potentially not at all strong, indicator of someone's engagement or someone's ability to seek healthcare, even after considering whether they even have health insurance or not. I think is really telling to the failure of our current health insurance model as well. It's just part of like this bigger picture of access that we're kind of talking about and thinking about here.
Okay, so this I'm definitely glad to be able to speak with both of you, because this is where I was already, becoming fuzzy and starting to fade into to black and all of that kind of stuff. But so you're starting with this point of healthcare precarity, that is, and you're using this the correlation table of who has access to doctors, prescriptions, and even just basic testing as part of the way of you're measuring that level of precarity.
Mhm.
Is that okay? And then down here, can you help me with what these numbers are saying here, that are talking about dependent and independent variables, the health precarity score, and then the financial literacy score, and then broken down by racial and ethnic demographics. Can we, if, to the extent you haven't already explained it, and I'm asking you to repeat yourself, forgive me, if, or to extend from what you've said, what are these numbers now demonstrating here in this article, or what are they showing here?
These are descriptive statistics. And so this is basically an overview of the data set that we have. So this tells you about the people in the data set so that you can get more familiar about who we're talking about. So for example, if we've got 25,000 people, almost 26,000 people in this data set, 19,000 of them are white, right? And 2,300 of them are black. So this is just giving you an overview of the characteristics, the social demographic characteristics of the people in the data set. How many of them were women versus how many of them were men? How many of them, oh, related to financial literacy score, I will point that out. So, financial literacy score, and that is actually a measure that comes also from the data set. But in the data set, they ask a series of 7 questions about financial literacy, and that's listed later on in the article. You can see the questions and the answers. But there are 7 questions. And so usually then, if you answer 4 or more questions right, then you're considered to be financially literate because you've gotten more than a 50 on the test. And so, based on this, this is telling us that the average person doesn't even get 4 of the questions right on the test, right? So, this is giving us an overview of the people in our sample.
When you say, so this 25,000 number here is you're saying a
That's the
measurement?
size of the sample.
Okay, that's the number of people.
Yes.
Okay. And where are we seeing the breakdowns of their scores? And this
So
is,
you see where it says mean 3.43?
yeah.
That's the
Oh,
mean score of the
okay.
people in the sample.
Got
Mhm.
you, got you. And you're saying, and that's what's showing the score out of 7. So most people, regardless of race or background, is what you're saying, just
Yes,
don't have
most
answers
people.
to this question.
Right.
Yeah,
According to how we define financial literacy, and it's not
right,
just we, meaning Kendall and me, but how lots of people define financial
right.
literacy, Americans are not very financially literate.
Americans are not financially literate, and then what are we saying, or what are I should say, what are you saying about Americans' overall healthcare precarity?
So, in general, in terms of the overall health precarity, most people don't fall into this category. So, if you
Mhm.
look at all these inputs together, it's not something, I mean, I guess half and half, but it's it's not something that affects a lot of people. So a
Hmm.
lot of people didn't have any health precarity at all. So when you look at the numbers, like there's a cliff because a lot of people are able to pay for prescriptions, they're able to
Mhm.
go to their doctor, they're able to do these things. So we're looking at in some ways we're looking at people on the fringes a little bit. But I don't know, Kendall, maybe you have a better way to describe what I'm trying to say.
No, no, I think that's exactly right. And I think that mean score of the health precarity scale, that point 0.5, really kind of suggests that overall, most of the sample was not experiencing this, like you were saying, Erica. And really, when we broke it out a little further, and we didn't break it down by racial or ethnic group, I don't believe. But more or less, like this was a relatively like small portion of our sample that was experiencing, scores like scoring whether it was like 1 or 3 on this scale, which indicates that this, like you said, Eric, it's really people that are kind of existing, sort of in being forced out to the fringes of access to healthcare.
Okay, right on. Thank you very much. Okay, so all right, so we've established the relative levels of healthcare precarity and financial literacy.
Yeah,
Uh
and here you're just looking at the income
oh,
levels. You were just showing like the income.
sorry.
You don't have to bring it back up, but like the educational levels of the
Right.
sample, the types of people that were included.
Okay, got it. Um so then how because you even, I believe, use the word novel to describe what you end up defining as financial literacy. But so could we talk a little bit about how the field more broadly, that is, and then you talk a little bit about some of the critical literature. I wanted to ask you about that as well, but how does the general approach, how is the general approach to financial literacy defined, and then how do you all suggest it be adjusted, and then why, and then yeah, we'll go from there.
It's whatever people want it to be. Honestly, like financial literacy can be what you want it to be. Some people say that it's about like just effectively managing your money. Some people say it's about like they give some specific characteristics. It's about retirement planning. It's about you being able to do budgeting, all these. So financial literacy has a whole bunch of different definitions and nobody can agree. And one of the things that we found in looking at different definitions of financial literacy, but really looking at, I think, the structural constraints that are put before people is that we wanted to make sure that our definition of financial literacy looked at more than the individual, because this is not about the individual. Essentially, what we hope to do with the paper is we hope to make it clear to people that you can have all the best intentions and you can do all of the right things. But to truly be financially literate, you have to understand whatever economic system you're living under. So in our case, this is capitalism, right? And so actually, we believe that to be financially literate, you have to have some understanding of capitalism and how you might be functioning within it. And so I'm sure that there might be other definitions of financial literacy that we didn't run across that may sort of bring together this idea of, do I have some responsibility in this? Sure. Can I budget? Absolutely. But I can't budget myself into more money. I can't budget myself into universal health care. And so that's really the point that we're trying to make, is that we wanted to have a definition that's like, you can't just tell people to manage their money. You have to show people where they are in the system, because people have to be aware that these other forces are keeping them from the things that they should have. So that's essentially it.
And then you did. There was at one point in the paper where you do mention that there is some literature critical in some similar ways of.
Thank you for reminding me of that because
Yeah,
you know
and
my
I was
mind.
well, I was curious about that. I had hoped honestly to look up and read a couple of the things that you cited, but I just haven't gotten to it yet. But so, but I am curious about what you found in terms of some literature that is maybe similar to your own criticism or what some of at least some of what is being said that's critical of the prevailing wisdom regarding financial literacy.
Yeah, absolutely. So there are not, I wouldn't say there are a ton, but certainly there are a few people. You had one on your show, so Max Haven, that you've had on your show before. I don't know if you remember interviewing him, but
Yeah, I mean, because I remember you sending me one of his articles way back when, and it kind of was blowing my mind. So I was like very happy to be, yeah. So yeah, yeah, and I know you reference him in your work as well, somewhat regularly. So yeah, 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 yeah. But yeah, sorry, go ahead. Yeah.
so Max Haven is one. There's also a team of folks, Lucy and Lainey. And the interesting thing, I think, in terms of looking at the people who are critical of financial literacy, is that most of the ones that I've seen, not all of them, but many of them are outside of the United States. So I've seen more folks in Canada and more folks in the UK than I have in terms of the United States. And you're a media scholar, you are interested in propaganda. And so that doesn't necessarily come as any surprise to me in terms of why are there more people who, at least I'm able to find their work, who are in these other places with sort of a critical lens or shining a light on maybe some of the lack of power around financial literacy in other places than in the United States. And so in some ways, to me, it's sort of akin to how in some circles, like if you think about France and you think about their history of protests and sort of engagement with working class people and that sort of thing, I feel like, maybe that's why we don't have that same level of engagement in the United States. But I don't know, that's all just conjecture. But so I would say for me, probably like Lucy, Lainey, Haven are some of the main people that I've seen who had this critical lens. And I think their message is the same, right? I think in academia, we're sort of disciplined to this idea of you're trying to find the gaps. And I think that they are working in different disciplines. We're in sociology. And so we're sort of saying, let's have a conversation about this sociologically, right? Let's talk about this. Many people who deal with financial literacy are in finance or economics, and that's fantastic and good. But sociology concerns itself with power and structures. And so, how does that affect the efficacy of financial literacy?
Right on. Kendall, did you want to add anything or?
Erika is the queen of financial literacy.
Oh,
I'm gonna let her have the floor entirely on this one. I'm learning so much, and I've been learning so much from her about financial literacy in that whole economic sociology space throughout this process. So I think she kind of covered all that I know about it as well.
so, but there is also a sort of a healthcare literacy or illiteracy as well in terms of what people think they understand about healthcare access and its impact on communities. So, I'm wondering now to what extent you are aware or see or look at a parallel between what people do and don't understand about healthcare and do and don't understand about financial literacy. So, is there a set of prevailing myths regarding healthcare that you are looking forward to more critical engagement of, or that you would like more of us to understand, that I don't know, that kind of maybe sit on your head the way buying power and financial literacy sit on ours, you know.
Yeah, I think it's really important to consider that piece about that access and the power differentials, whether that is, feeling comfortable to walk into a healthcare space and to actually be listened to, especially for like Black women. And I think too the considerations around like medical cynicism, where we think about like people not trusting the medical institutions because of past, the past medical horrors that we've seen in the US. I think it's really something interesting to think about too, especially as someone that uses a lot of like health indicators in my work. So like, how do you feel about your health today, more than necessarily say, like, have you been diagnosed with with these other diagnoses, these other health conditions? And we all often think about that impact of access, and of, oh, are you going to seek out care if you're having these issues? Can you afford it? Can you are you being listened to? Are you being believed as well? And that, constantly is sitting above all of our heads as health scholars and our work. And I actually haven't engaged more with that healthcare, health policy access literature, but coming from this paper especially, it's been something that I've been thinking about, maybe taking a deeper dive into a little further into the dissertation process, but just thinking more critically about, what do we miss when we as health scholars are thinking about the health of populations, when we are using have you been diagnosed with like kidney disease? Have you been diagnosed with like a stroke? Or are you on medications for high blood pressure and things like that? What is missed from the information, just as a function of the limitations of the U.S. healthcare system?
And if I could say something
Please.
about Kendall, your work, and without saying too much about your work, I think one of the interesting threads that's coming out for me is that financial literacy is interesting to me because I'm interested in money, and I'm also interested in how sort of the state and the apparatus use things that are supposed to be benign, and they use them against people. And I think Kendall, in her own work, is looking at some things that we assume to be benign, like the social services systems and other things, right? And the effect that those things have on our communities in ways that people are like, no, those are the good guys, right? Like, so financial literacy is the good guy. So why would you have anything to say? Like, what's wrong with y'all? Y'all don't want people to be able to balance their checkbooks. Y'all don't want people to checkbooks. I'm aging myself. You know what I'm saying? Y'all don't want people to be able to like have money to go on vacation. And it's all very like, I feel all the time like we are a bunch of haters, because it's like, why would you be mad at financial literacy? Like, what did it ever do to you? And I think that's the gag, because it's not a benign thing. Financial literacy and the power that it has over people in terms of how they view themselves, how they view their communities, is a very important thing. And so I think this study really helps us to see that it's okay for us to say that financial literacy is not bad. I don't think Kendall and I are saying like we both budget in, like we do those things. But we're like, it's not doing all y'all say it's doing, and stop saying it. Stop saying that this is the panacea. And then if you just do and get financial literacy, then everything else is going to be okay, because it's just not true.
So you make this point at the end of the abstract. In fact, you say that your findings complicate existing claims that higher levels of financial competency protect people from making risky financial decisions, including those related to health. The research, and that you say financial literacy conferred no benefit for Black adults and increased the likelihood of experiencing health precarity for Hispanic adults. So could you talk a little bit about how you reached these conclusions, and sort of to make the point that you were just to extend the point that you were just making there, Erika, that you're not trying to just be a hater, though, some of us,
I know you
but
like being a hater, so this
I
right
don't.
now
I have
your
no
lane.
problem with it. But but you're not just trying to be a hater.
We're not.
You're trying to make But at the same time, you are saying. I mean, you say it right there. It's not helping Black people, and it's making things worse for Latinos. So could you talk a little bit what you mean by that, and how you all reach those conclusions?
So Kendall's our methodologist, so I'm gonna toss this ball to her. But yeah, you're absolutely right. The whole point is that we wanted to be able to say, overall, like if you don't pay attention to race, then again you can keep building the narrative that of course financial literacy is helpful, right? But when you actually take a step back and when you look at race, things are different.
Mm-hmm. 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 And Erika, in your own dissertation research and like your other work, you're kind of like building upon these ideas, I think, and like critically examining them from like other vantage points as well. But for this project, when we were looking at, health precarity as a function of this financial literacy. And when we looked at it with the full sample, with everyone, regardless of race, we were quote unquote controlling for race, so we counted for that. We found that it was more or less beneficial for everyone.
Yep.
But as soon as we, separated out the racial groups essentially, and we looked at like their individual relationships with financial literacy, it became very quickly clear that it was not a racially uniform effect. It seemed like white people, like you were saying, benefited from it, and Asian people at least did not differ from white people. So we can somewhat say that it seems to be somewhat beneficial for Asian folks, but as far as like Black and Hispanic, the story became a lot more complicated very quickly. So we actually were able to, it's called an interaction. So we were able to specifically look at the effects of financial literacy for Black people relative to white. And then when we did that, we found that not only did Black people benefit less, they just didn't benefit at all. And then when we did the same thing for Hispanic adults, it was a similar story, just worsened, where, knowing and understanding more, at least about whatever financial literacy measure it says it measures, actually like worsened their health precarity, meaning that they even less were willing to go into healthcare spaces to do this as a result of concerns about costs. I think that piece about the concerns about costs were really telling, because it's not like we were just looking at healthcare precarity broadly. This wasn't just people not willing to engage with healthcare for a number of reasons, potentially for medical cynicism, or just potentially for hesitations around just going to the doctor in general, not having time, any of those things. It was specifically related to, we don't want to do this because it's going to come with potentially a lot of cost. And I think for this project, that was just really, really telling, especially when we, didn't look at this like, oh, blanket approach of financial literacy is great, it's going to be wonderful, and then actually like challenge those ideas here.
So, and if I could just add on to that, so just like headline level for Black people, because I know that's mostly what your audience is here. So I'll focus in on Black people. So for Black people, as your financial literacy levels increase, right? So you're doing the things according to the questions, right? You're getting more financial literacy. As your levels of financial literacy increase, so do your levels of health precarity as compared to white people. So as you learn more, as you are able to better answer these 7 questions, then that means you are also more likely to not be able to go to the doctor, not be able to get a prescription filled, not be able to get a test done because you don't have money, and all of this compared to white people. So you can draw your own conclusions from that, but it just don't work the same.
So, okay, I'm almost hearing it's like a version of the old ignorance is bliss claim that people are more likely to show up and try to get health care if they don't know more about the negative financial impact it might have on them. Is that did I hear that right, or is that at all? Because it
Not
sounded like you were
exactly.
saying the more people are aware of what the financial situation is, the less likely they are to go after healthcare. Did I hear that
Well,
right?
and keep in mind that this idea of these 7 questions, one of the things I know, and if I
And we're
ever
going to
do
get
other
to those
research,
7 questions. I have many
if
questions about the 7 questions.
if I get to the other research, right? Like, I'm not necessarily sold into the idea that these are the right questions. So I think what I'm saying is that I wouldn't be willing to make that claim. But I think the claim that we're making in the paper is that based on the questions as they are set up, right? So we're just accepting these questions, that as you get higher scores, then you also appear to be more likely to fall into one of these categories, or you weren't able to go, you weren't able to get tested, you weren't able to, for Black people as compared to white people. So that's just basically, now again, I have my own ideas and thoughts about the questions, their validity, if we should use them, but that's not necessary. And so we talk about that in terms of future research.
I also think too, just to add on a little bit, I think it's more than just like what those questions are asking. I think it's the idea behind the questions and behind that financial literacy idea and argument that's being like forced upon people in this very individualized, like it's on you to understand your finances and to understand how to maneuver this capitalistic market. So it's the idea that financial literacy and getting more financially literate, getting better with money, improving your financial well-being is supposed to be this protection, this protective factor, and protecting you as a human. And you can individually improve your life chances, improve all these aspects of your life. And I think for me, that was like the takeaway of this paper is like, okay, this thing that is being nicely sold to us is in a nice little like bow tied present box and saying, here, this is how you like do better. This is how you like rise and improve your life in these ways, is just kind of, it falls apart so quickly, so quickly. And I think, so it's more than just, for me, and I think for us, Erika, it's more than just like these 7 measures. It's like the
For
promise,
sure.
the
For
promise of
sure.
this financial literacy idea. And so I don't think it's necessarily if people actually are better or like know more about these questions. It's just that's not actually a way for people to move through this world and improve their life chances. And that's kind of where this definition comes from as well. This sociological take on financial literacy of this context. It's like, no, no, no. You can know as much as you want, but like Erika was saying, you can't out budget your way out of poverty. You can't out budget your way out of making almost barely enough money to survive. And I think that's kind of what we're picking up here. And it falls apart so quickly when you take into those other contextualized factors.
Yeah, absolutely. Again, what I thought was you touched on it just there, but one of the many important points that you all make, and that is just rings powerfully and importantly clear in this article, is that people's financial condition is not just the result of their self-determined choices or their intelligence or ignorance around financial literacy or anything else. That there's a whole set of factors involving, as you starting importantly with capitalism, that lead people to where they are.
One other quick thing, if I
Please, yeah,
could, just
please.
related to this idea overall. And so I think for me, one of the more insidious things is that not only is it all this individual responsibility gets put on us, right? Like all the things we need to do, but there is a study, and we cite the authors in our article, that talks about people of color are more likely to be given financial literacy courses. Like, so it's also something that gets pushed onto certain communities more than others. And so, of course, you have to ask yourself, why might that be the case? Like, why are they inundating us with financial literacy education in ways that they might not be with other people? But again, to the point of propaganda and media and all of these things, I think they do all play a role in this idea that we have about our individual power and ability to be able to outmaneuver capitalism, which is wild.
So I did, forgive me for the, I do have to. So there is for me this important for me as a far left political critic of the established political order and including the Democratic Party. There for me is a kind of overlap between both of your areas of expertise that is somewhat referenced even in this article, between that is represented in the figure of Barack Obama. So for instance, in terms of healthcare, Barack Obama is thought in many ways to have provided a healthcare solution far, in advance of anything that could have been hoped for at the time, and maybe even today, and has also been at sometimes seen to be sort of uh, uh, the singular light on the hill in terms of Black excellence and in this case financial literacy. But he in as I'm reading it, in both cases extended previously existing white Republican programmatic solutions to these problems. That is, what is called Obamacare is really a rebranding of an old Republican plan to wed health
Mitt
care.
Romney's.
Mitt Romney's to wed private insurance to healthcare, to healthcare providing. And then Erika's, you've written about, he's also extended, if I remember correctly, Bush's presidential financial literacy program to address the Wall Street collapse of 2008, as if to suggest, as you've pointed out, that collapse was the responsibility of poor people and working people, somehow dragging down the whole world's financial, whatever. Is First of all, I mean, do I have I'm interested if what either of you or both of you think of this parallel I'm drawing, and then what I think is in many ways a segue to the 7 questions that you have at the end, that are meant to assess one's financial literacy. That is, that we get this seemingly progressive rebrand of something I would argue is not, that is meant to lead, in this case, Black people to some higher level of understanding of the situation and an improved condition materially, but that we don't get there with any of these bits and pieces, and we get an insufficient healthcare situation, even though, as you've said, less people are fit the definition of healthcare precarity than I might have even thought, actually. And then, but we still end up with this insufficient approach to financial literacy, with, as you said, that is over promoted to specifically Black and brown and other, relatively poor and oppressed communities, and with this idea that here is a solution for you. And in neither case do we have what I think is necessary, that is adequate health care and adequate understanding of the political economy of the society and what to do about it.
So
Yeah,
how
go
about
ahead. Yeah.
I'll take this one. Okay. So I am, you probably know this, Jared, but people who don't know, I am no friend or fan of Barack Obama. But here's his role, and I don't think his role is unique. Okay, so I think if you look at financial literacy and how it has progressed across presidential administrations, whether they be Republican or Democrat, I think that should be clear to us that this is just something that capitalism and the state requires. So I don't think it's a partisan issue at all. So while I'm no fan of Barack Obama, he did it. His predecessors did it. His successors did it and are doing it. Like, that's what it is. But I will say, I do believe that Barack Obama one of his key roles is as a tool of counterinsurgency. And so I think we see that counterinsurgency through Obamacare, because I think if you give oftentimes people just enough, then you can quell all of the things that could happen otherwise. So I think Obamacare came and was sort of this counterinsurgent thing to do. And I do think actually that financial literacy is a counterinsurgent tool, because just like Black capitalism, I think, is a counterinsurgent tool, because I think these are all things that turn people and make them internalize whatever is going on, as opposed to saying, we should be pointing our fingers at y'all and all the stuff that's going on, but we're not doing that, right? So we're taking on all this personal responsibility and accountability. And of course, Barack Obama, in famous fashion, is pull our pants up and all of these other personal responsibility, like the personal responsibility rhetoric that he shares with the world. But I think that's the role of the state. So as him as the figurehead for the state at the time, and then whoever is the figurehead of the state, like, I think that's what they're supposed to do, is they're supposed to get us to believe that we shouldn't require anything from our government, right? That we need small, and I think this is, again, Democrats and Republicans, I think we need less government, we want less intervention, we want everything laissez-faire. And that's what financial literacy helps us to pivot towards. It's, what can I do to be able to enhance my financial self? And then at the end of that, I don't want to cause trouble. So I think the counterinsurgency is chef's kiss, it works.
Yeah, right on. Absolutely. So okay, let me
You want to talk about the
pull
questions?
yes, I'm just saying, I want to pull up these questions again, and because, as I said before, and Erika, ever since you first introduced me to this as the process or mechanism by which financial literacy is often popularly discussed in some academic circles, I was really blown away. I admit a ton of ignorance around this, and just could not believe this is these are the questions that are so often used. So before we even get to the specifics of these questions, let me just start with that last point I just raised. To what extent are these the questions that set the definition for how financial literacy is assessed in academic spaces? If
So I think for me that's still tough because there are so
Okay,
many definitions. Like
okay,
so a lot of definitions do have this idea of competency and numeracy. So people are just interested in this idea of can you do math, but maybe some weird math, um, and then does this show what you're able to do? And so over time, the base of these questions really started to get formed in sort of, I'll say, the like in the end of 2000, like with the Great Recession is really when a lot of these questions started to get formed, and then over time they've added more and added more. And so now we just decided to use all seven of the questions. Some people, in their research, they might just use five or they might just use three historically. But I think the point is that for me, money is personal. And so it's personal finance. And so I might be at a point in my life, or I am at a point in my life that's very different at the point where Kendall is, right? So I think that there might be certain things that I need to know about money because of where I am that Kendall might not need, and vice versa, just because we're at different life stages. And so part of the thing for me is I think that the questions, whatever they are, in terms of if somebody wants to assess your literacy, I don't know that there is a single set of questions because for me, it really depends on where you are. So I could even see a situation that you have questions maybe by life stage and or maybe by goals or things that you want to do, but not just general questions. And then we're all asking and answering the same things, but we don't all need the same things. And so people with money are asking different questions than people who don't have money. Like if I don't have money, you don't have to talk to me about a 401k in stock because I ain't got money. Like I don't need to know that. And knowing that is not going to enhance my life. So the questions are a very muddy thing, and but still we people use them.
okay. Well, all right. So when you say that they might use seven or three or one, whatever, but do you to what extent? But you wouldn't say that you often have come across an entirely different set of questions being used. It's
I have not. So
okay.
not to say that it doesn't exist. I
Right,
just
right,
haven't seen it.
right.
Most people who are doing financial literacy research, when they're coming up with a score, they're using some derivative of this set of questions.
And when we're talking about the most referenced scholars and the most invited and often attributed scholars regarding this, these are the questions that they seem to be using. That much I think is fair to say based on what I've read of your work. Does that make sense? Is that
Yes, and
oh,
I think that it is also probably fair to say that they generated some subset of the questions too,
okay?
created them. Yep.
All right. So question one: suppose you had $100 in savings in a savings account, and the interest rate was 2% a year. After 5 years, how much do you think you would have in the account if you left the money to grow? So that so when you said it was what was it less than uh now at the time what was the percentage? Because what was of
Oh,
people?
don't make me remember the percentage of each one of the questions that people got right.
I got to go
I'm not
back up
going
to the top. But I
I'm not
was
gonna
but
remember that.
where you had
Oh, you mean the overall
just
level
the
of savings?
overall
Less
um
than 50%.
yeah, yeah, okay. Because out of
So
the
it's less than
7,
50%
yeah,
because
yeah, yeah.
it's 3.4 out of 7.
Right, right, right. So it's because and then how much time do people get to answer the question once it's asked?
I don't even know how many people get. I mean, how much time people get. I don't think they're like rushing you, but I also don't think that they're giving you minutes to answer. Like people are taking minutes to answer each question. I will tell you that in my dissertation research, I asked people these 7 questions and gave them time to do it. And usually it would take people like 5 minutes to answer the questions.
I mean, I could tell you very quickly, I don't know. Like I could rush through it. Like it would take me like when I read the article the first couple times I read your article, I was like, I didn't even attempt to come up with an answer.
And
I was right here.
that's fair. I think like the question for me, like if I think about what's interesting, like I think the question about inflation, because there has been so much talk in the public discourse about inflation over the past few years, I think that's probably something that more people get right than wrong because everybody's talking about it, right? So, in the same way, I think if they were to ask about tariffs, there might be more people who would get it right today than would get it right 4 years ago because there's been so much conversation around tariffs. So, I do think some of it is just based on, Jared's like, no, 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 no.
Well, I don't know because often enough, the more something gets discussed, the less it's clear or the less it's discussed accurately. So I don't
Gotcha.
know. I don't know if, but you might be right. You might be right. Imagine that the interest rate on your savings account was 1% a year and inflation was 2% a year. After 1 year, how much would you be able to buy with the money in this account? Is this supposed to be easy?
So here's the other thing about it. As I think about our definition, including sort of your space in whatever economic system that you're in, this is a question that to me is interesting because I think a lot of people, I think probably more people should understand how this works because, for example, for let's say you're on social security and you're getting your social security increases and the government is like, okay, this year you get a 1% increase, or even for your boss at your job, you're like, oh, my boss says I get a 2% increase this year. I do think it would be interesting for people to know how much more does that buy me, if any, than based on the level of inflation that's happening in the country, right? But I think it makes sense that people don't know that because it's too much to know. And that's a part of the problem. Like it's difficult on purpose. So, on the one hand, if you were to ask me, should we know how much the inflation rate is? Probably. Should we know how much our pay increase, if we're lucky enough to get a pay increase, compares to the inflation level? We should probably know that too. But I understand why people don't. And so I'm not mad at people for not knowing that. And I also think that it is unrealistic for us to ask people that sort of a question and think that they would understand or know.
Well, and then, as I'm looking at this, I'm thinking, well, I can't answer almost any of these questions. And I'm solidly middle class. So what does that say about
You're more
financial
than solidly
literacy?
middle class over there.
I'm not, aren't I? I
No,
think so, right?
you know the bar for middle class is very low. So
That's true. That's true.
yes.
But, but, um, but my point is that, I mean, uh, our bills are paid and, I might be able to go get a sandwich.
So why don't
So
you know about bond prices and the relationship to interest? Why don't you know that?
I, I that's a fair question, but I think more important, Erica, is not what I do. I know the real question is what does this have to do with the economic condition of an entire community?
Nothing.
And that's what I keep saying. Like that was because I feel like I meet a lot of people or I read about more people with more money, and they don't seem to understand much. I don't feel like they would pass this. You know.
Well, but here's the difference though. And I think this
Mm.
is another one of the tricks that gets pulled over on us. When you have enough money, you pay somebody else to do this. You don't answer this survey. You
That's
don't
what I'm
like,
saying.
and so that's the trick. The trick is that we get to thinking that we have to know, in order to be financially successful, we have to know the relationship between interest rates and bond prices. You don't. Like, honestly, if you had enough money, you would just pay somebody to do all this for you anyway. But they make it seem like, no, it's just you. You just got to get in there. You just got to read more. You got to
But
learn
it's
more.
also we get a lot promoted. There's a lot of promoted discussion around this, around financial literacy, and celebrities are talking about financial literacy. I just saw, I forgot which one. Another celebrity started some financial. What's his name? Who does basketball analysis on ESPN? Uh,
Oh, I
um,
don't know that. I don't know that.
I should know his man, what's his name? But anyway, he used to play point guard at Duke and then hurt himself on a bike motorcycle and then he does analysis. But my point is he's telling everybody financial literacy to improve your condition. And I just feel like these are not answering these questions are not going to be are not the reason why in this case Black people are poor, and knowing these answers is not going to get Black people out of poverty.
So here's, I guess, a bad comparison. So we're talking about literacy here, right? And so
Mhm.
I think some of the literacy specialists that I know, they're like, when you're having your kids read, tell them to read anything, right? Like they're just interested in you reading anything because reading anything is helpful in terms of building the muscle, getting reading comprehension, like doing all of those sorts of things. And I think people apply that same language, that same logic to financial literacy. Like learn more about your money. It doesn't matter what it is. But I think at a certain level, it does start to matter. So, for example, I'm going to out myself and say that I read smut, right? I'll be out here with the Black erotica. And it's probably not making me better as a person. So I'm like, do I have literacy? Yes. Is it in the right area? Probably not. And so that's what I mean about like, it really does need to be financial literacy for you because everybody is not at the same stage, everybody's not doing the same thing. And so that's why it's so insidious. It's because it's like, why y'all mad at literacy? What like all literacy is good. Well, yes, all literacy is good, but my smut is not doesn't I don't think has the same value as some other things I could be reading.
That is hilarious. All right.
I'm the only one that reads smut. Okay, it's fine. It's fine.
Look, I don't. Yeah, I wouldn't just say that you're the only one who has whatever different tastes,
Proclivities.
but I don't know proclivities. But one, I'm not out here to self snitch today, and two, I don't know anything about that particular one. So um, the but again, so this one, you suppose you owe $1,000 in a loan, and then the interest rate you are charged is 20% per year, compounded annually. If you didn't pay anything at this interest rate, how many years would it take for the amount you owe to double? I mean, I could probably figure that out if I really sat down for a few minutes and didn't think about anything else and really struggled. It would take me a while, but you know, okay.
One quick thing about interest rates I will say is that a
Hmm.
lot of people do buy cars, and I am
Hmm.
sometimes amazed by the people who go and buy a car and they don't have an understanding of like what interest rate is reasonable and when you're getting fleeced.
That's true. That's true.
And so um but again, I think that that's contextual. So again, our definition is like you want to understand the environment that you're in. I do want somebody when they go into a car dealership, if they tell them they need to spend an interest rate that's over, I mean, if you have moderate credit, let's say like 9%, maybe 10, like you're starting to get into that realm of like, this is really not good, warning sign, warning sign. But that's a specific context for specific action that they're taking. And so, again, I'm not against knowing about interest rates and knowing when somebody's taking advantage of you. But then I also know that sometimes because we're living under this credit system, people got to take a 20% interest rate because they got to get a car because they have to go to work. And so even when you know, if I need a car, I'm still going to sign up for the 20% interest rate because I need a car. So knowing doesn't help me stop doing that.
Yeah, exactly. Yeah. In fact, I've been there. I know this interest rate is going to kill me, but I have no choice in the moment.
Yes.
But yeah. Um, which of the following indicates the highest probability of getting a particular disease? Uh, uh, I don't see where I forgot where I didn't see. I lost track of where the list of the possible choices are. But
Oh, there's a 1 in
uh,
20 chance, 2% or 25 out of every 1,000 people.
oh, okay. Oh, right.
How is that anything to do with financial literacy? I'm
Yeah,
so confused.
I
that's a
guess because you're not going to be able to get vaccines, that maybe you need to understand your likelihood of getting a disease because we'll be getting more of them. I don't know. I'm not sure.
yeah, that's a great question. How in the world does this relate? And a 15-year mortgage typically requires higher monthly payments than a 30-year mortgage, but the total interest paid over the life of the loan will be less. As a true or false question. And then 7, buying a single company stock usually provides a safer return than a stock mutual fund. And again, I think that that's far less important than the accumulation of stocks among the top 10% of the population. So like those are the things that I think are far more important than, do you know what stock is going to do what, which, and where. And again, that an entire population is relatively poor because they don't know the stock market is super frustrating, which is again why I'm so happy that you all are doing this work and have produced this much already, because this I find this stuff infuriating and the this is something I would, if I were keeping up with your pace more appropriately, I would maybe be wanting to, and maybe I will, or someone out, maybe you've come across this, or but I do think that there's a nice piece waiting, a component to your work that focuses on the amount of messaging that, in this case, Black communities get promoting financial literacy as a solution. That some real research data around how many ad minutes people are confronted with that promote financial literacy, or something to that, something like that. Because I think
Kick
it's
it off and
tremendous.
ask us to jump
And
on.
yeah.
We'll
I'm
be
sorry.
happy to be your co-authors.
Well, I have to catch up to your levels of organization and discipline, first of all. But I just wanted, I'm just putting it out there, maybe as self inspiration, or for someone else to pick up on, or find existing research on. But even to this example that I was struggling to remember in terms of his name. I want to say Jason something. Anyway, but that I saw again. Wait a minute, your claim to fame is basketball, and then basketball analysis. Where is this even coming from? That not only are you promoting this, but you're promoting it with such a level of authority. Other than obviously the obvious, you've been paid to sponsor this, but it's that, like, as an audience member, I'm now supposed to think, wait, I'm decades watching you talk basketball, and that should automatically now mean I should accept your claim that we should take financial literacy courses to better understand the situation here. I just find that to be bizarre. So I would, um, is there anything else that I haven't invited that you would want to raise about your work here? I know I was selfishly, wanting to get some help with the methodology, but but as I've said already, and would want to continue to say, like, I think what you've done here is really important, and yeah. But is there, from either of you, anything that you wanted to make sure we address that I didn't?
The only thing that I would want to reiterate is just that financial literacy can be a tool for managing your money. It is not a tool for liberation. So I just want people to be very clear about what financial literacy can and cannot do. It's not going to get you free. It's not going to get you more money. That's just not what it was intended to do.
Maybe we could say it might help you stay where you are, but won't help you improve. I don't know. Maybe something like that. I don't know. But yeah, I'm glad. And Kendall, anything you would want to add? Maybe even specific to your focus on healthcare, or maybe tell us about some other work you're either have done or are doing. Is there anything you can give us a preview of, or?
Well, I know that Erica and I have some other projects that we're kind of thinking about, kind of using as this is like a launching point into thinking more about how these ideas around individualism and how this like top-down approach that the government and these institutions are kind of like forcing upon the public in this like sense of like, oh, this is protection, this is a way for you to individually benefit yourself, and here's this education. We've been thinking a little bit more critically about how to really think through that and how to like examine it empirically as well, and do more tests and analyses and whatnot. So really excited about those things going forward. But as far as me right now, I really want to get this dissertation done. I'm really excited about thinking, or it's been a really exciting process to think about how these other institutions like healthcare and, child welfare, how they are essentially extending the authority of the state into people's domestic lives. And now, like, this is another way of thinking about this financial literacy. It's essentially the state offloading that responsibility and exerting power into people's lives, in as much as them like removing themselves from that responsibility, them absolving themselves. So it's been a really interesting way to think about healthcare engagement or disengagement because of cost as a result of this institutional failure essentially to care for its citizens. And so in my work, thinking about it in other ways, whether that's like the state, like states, and thinking about how they encourage people to become like more part of the social fabric of a nation, and just thinking about the different ways that that's been exerted over time, whether that's through like incarcerating people that aren't able to conform to these ideas of what it means to be like a good, upstanding, moral citizen, despite like divestment from neighborhoods and these communities, and basically just isolating them. And then thinking about the other institutional responses, like I mentioned, child welfare, or just controlling over people's family planning and access to other resources. So it's been a really interesting way of thinking about this through like the financial literacy lens, as well as in my own work and more the punishment surveillance side of thinking and things.
The punishment.
And we also need to talk about how financial literacy it encourages people to punish and discipline themselves. And so what parallels there are between what you're doing on that side and on this side.
Absolutely. Definitely have to think about that down the line.
All right. Okay. Well, listen, future doctors Riley and Brown, thank you very much again for what you've already done and for what it sounds like you're going to continue to do. I'm very excited to hear there's more coming from the two of you collaboratively. I know you'll do a lot more independently, but thank you very much once again for the work and for joining us. I really appreciate it. Thank you.
Thank you.
Thank you. It's nice to meet you.
And what do you sacrifice?
Calm, kindness, kinship, love. I've given up all chance at inner peace. I made my mind a sunless space. I share my dreams with ghosts. I wake up every day to an equation I wrote 15 years ago for which there's only one conclusion. I'm damned for what I do. My anger, my ego, my unwillingness to yield, my eagerness to fight, that set me on a path from which there's no escape. I yearn to be a savior against injustice without contemplating the cost, and by the time I look down, there's no longer any ground beneath my feet. What is my sacrifice? I'm condemned to use the tools of my enemy to defeat them. I burn my decency for someone else's future. I burn my life to make a sunrise that I know I'll never see. Now, the ego that started this fight will never have a mirror or an audience or the light of gratitude. So what do I sacrifice? Everything.
I mix what I like.